of FabCare, and as I hope Enrico will, after the talk, continue and explore in this session. It's a pleasure to have you all here.
Okay, so yeah, we can keep the chat open. Seems to be a good idea. Welcome everybody. Just a very brief introduction. This is the first meetup we run online from FabCare. FabCare is just an international group of labs and people that want to improve and innovate health and care. Many of the people here today are friends we met doing this kind of projects. We will try to keep maybe a bit of the time at the end for discussion or for new suggestions. Today we speak with Jason about medical devices. What is a medical device and what is not? What can be done in a Fab Lab, and how can we improve eventually the capabilities of lab to intervene in health and care? But I will let Jason introduce himself and explain what we're going to work on today. In the chat, Adriana shared the link to join the FabCare WhatsApp group. That's the way we keep in touch, and we can use it to share project ideas and support each other. And I would say that's it. So Jason, the floor is yours.
Great. So good afternoon if you're in Europe, good whatever if you're somewhere else. I'm Jason. I come from Brussels, Belgium. I was born of a physicist and a cardiologist, which is why I probably a big reason why I ended up doing healthcare stuff. And importantly, for Fab Lab stuff, I was raised in the free software world. So my father is not only a physicist, but also, and he's also very much a free software activist. So Linux all the way. Beyond that, I'm a biomedical engineer and I like to learn languages, mostly Belgians, plus German, plus whatever came on my way while I was living abroad. If you're looking for me, the easiest way to find me is LinkedIn. I also have my website from the Fab Academy, but you'll just find my email, which you can also find on LinkedIn, and I'm way more responsive on LinkedIn. And also, yeah, I'm building another website, but it's not up for the moment, so easiest is to do that. Beyond that, I'm also a maker, and that's also why I'm, talking here, very interested in whatever we can build in health. Because I'm convinced that if we want to be happy, we need to be able to be free to do whatever we want. In order to be able to do that, we need to be in good health. And therefore, those two are key. And beyond freedom, I think that sovereignty is key, because sovereignty is the capability to control your own future, and therefore to give you freedom. Do you see my screen correctly, maybe, Enrico?
I think no, we cannot see your screen, just only the...
No, I can see it. Someone opened the whiteboard, but
okay.
I closed
And
it.
now is it? No. Okay, I'll try again.
Okay.
Does it work? Good. Oh, yes.
Yes.
So, and beyond that, who am I? Professionally, I work as a freelancer in product and strategy in healthcare, specifically in medical device, which is what we're going to talk about now. But currently I'm working on digital health. What is digital health? It's a bit changing practices in healthcare. It's basically software in the healthcare world. But what is digital health? In a nutshell, I would define digital health as medical devices are usually like improvement in medical devices, mostly improving the technology and the performance. While it cuts stuff, is added cryoscale scalpel, well, it's the same thing. But then you move on to Da Vinci robot. Well, you can do the surgery from a distance. So there you have both the medical device part and the digital health, where it changes. Now let's dive into the meat of it. The objective is this presentation is to be practical, pragmatic, and useful, but it's not legally binding. So the objective is really that you know when to call a consultant. You know, if you're like talking to someone as a doctor, that's a critical thing, as an investor, as a doctor, or someone facilitate working with people developing medical devices, when they're bluffing and they do not know their stuff, or if you're starting something, that's probably your case. When you're starting a project, what if it will be costly in time and money? Now, important notions, again, I said it in the beginning, I'm talking here only about EU. Every country has a different legislation. And yeah, fortunately, Europe structured that together. Unfortunately, they didn't make a clear legislation for the most part. I'm just talking about here the qualification. So it's not about the class of your medical device, it's only of whether you are concerned by this regulation or not. That is the only question. Are you concerned by the European regulation or not? And that, the first one is you're selling in Europe or you're manufacturing in Europe. If you're not, you're not. I see in the chat that someone says Europe is not so much better than the US on many ways, but not in the medical device regulation and medical device development process. The US is so much better than Europe on that account. And I, like many people know how much I don't like the US on different accounts, especially the healthcare system is particularly unfair, but the medical device development process is particularly fair because you actually can talk to the FDA, and in Europe, the notified body is really a complicated question. But that's not what we're going to talk about. What we're going to talk about is whether your thing is a medical device or not. So starting in the beginning, we're talking about the medical device regulation, which has been voted in 2017 and replaced the medical device directive, which was voted in 1993. There is a transition period until 2024. Apologies, this transition period, because they're so late. European Commission is so late. Actually, there's a transition period now until 2029 for specific stuff, not really relevant. The important step is that this new regulation, the medical device regulation, extend regulation so that software is covered. So now if you design software, you're also concerned by the regulation. And actually it's in a class of risk where you actually need to do stuff, where in the directive voted in 1993, there was very little that was covered in terms of software. To take a responsibility away from the doctor. So as I was saying, so that it's on the recording, in a nutshell, to be a medical device, you need to take medical responsibility. And if you forget everything else I say, remember only this: you need to take medical responsibility. So what that means is, if what you have fails, and it would be if the doctor would have taken something else off the shelf. I'll give an example. You have a kitchen knife and you have a scalpel. A doctor which has an emergency is in a train station and use a kitchen knife to like do surgery. He's using the kitchen knife as a medical device. He assumes the responsibility to take a kitchen knife and to do the operation. This operation is under his responsibility. If something goes wrong, it's his responsibility. You call a scalpel, which has medical purpose, which you tell, okay, man, you don't need to worry, this is appropriate for a surgery, then the doctor will say, okay, I take that into account, I will use it. I don't have to think and take the responsibility of using this random kitchen knife. I can take this, which I will pay a premium because you will market it and sell it for a higher price, most likely, because you will have made more tests to make it secure. And so in a nutshell, to be a medical device, you need to take medical responsibility. I'm hammering this down because this is the most important thing, and the thing that I don't hear many medical device consultants as the key thing to understand. Now, There's different steps in the medical device regulation that goes to tell you that kind of stuff. But I took the engineer's way or the maker's way to make it understandable. There's a long piece of text here. In a nutshell, this whole piece of text is, would this be done by a doctor? So if the thing that you're doing is done by a doctor, if it wasn't done by your device, that's a right analogy. For example, you have a device that is specifically intended to be used for medical purposes. Is the difference? It needs to be used in the medical world. So if it's a general communication app like WhatsApp used in the medical world or in the general world, WhatsApp used by a doctor, it's, you can imagine a little guy mixing maybe with the next condition. But here, really the goal is, if it's a kitchen knife versus a scalpel, well, it can be the very same tool, but if the doctor assumes use it in surgery, in a medical purpose, the kitchen knife doesn't become a medical device. The doctor makes it a medical instrument, but he's taking the responsibility, you are not. When specifically intended by the manufacturer to be used for one or more medical purposes. And we'll see what's a medical purpose, a medical device. Well, all of this: diagnostic, prevention, monitoring, prediction, prognosis, treatment, alleviation of disease, compensation, the same, but for injury or disability, or for investigation, or etc., etc. But in a nutshell, it's something to be used in healthcare that takes responsibility away from the doctor, but is not a drug. But it's to be used in healthcare for a medical purpose. So something that you know will be, some things like diagnosis, prevention, monitoring, that takes a responsibility away from the doctor. I'll go back here and give the example of WhatsApp. WhatsApp is a general purpose tool. It's not done by a doctor. If you remove WhatsApp, communication would not be done by a doctor. The doctor would write a piece of paper and give it to just a guy running. Running to communicate this information, transmit this bit of paper, would not be a doctor or a healthcare personnel. That's not important. That's one way to look at this. Look at the chat. I see Rico asking, responsible, I mean, take legal liability. Yes, definitely. That's the kind of thing. But again, in a maker's world, not in a legal liability question. So yes, in a nutshell, that would be liability. And therefore, to protect the patient has less responsibility, we push that onto the manufacturer of the medical device. The question about what about self-testing device from Antonio, I'm not sure I understand what's the question. Is it a self-testing device? Is a self-testing device a medical device? Definitely, because the person analyzing the results, you would expect that they have some medical training to do the scientific work, the manipulation of the samples properly. And there, if it fails, well, it would be done by a healthcare professional so that it's done appropriately. It's not like just a random Joe. So medical device definition, basically it is done by a doctor, takes responsibility for him, but it's not a drug. Well, why? Because if it's a drug, if its action is pharmacological, immunological, or metabolic, basically it's a drug or an implant or some sort of drug, large meaning drug or medicine. Intended use. Now, this important thing that I mentioned a couple of slides ago, which is the label. You take a kitchen knife, you take the regular knife, the only thing to do is the label on it. Well, that is what we call the intended use. That is what the manufacturer intends the device to be used for. And how do we define intended use? It's, well, however you present your product. So if you just say this thing is to be used in surgery for a knife, this would make it a medical device. If you just sell it in a regular knife store and you don't mention anything about medicine, it's not a medical device, but it's the same product. The thing is, if you now say, well, I want to use it in surgery, there's a high likelihood that you will need to do quite some testing on it. And therefore, this intended use forces you to do quite some more stuff. So yes, you will be possibly able to for more money. People will have higher expectation, and you will have more liability because you're responsible for all the tests that needs to be carried out. There's an important thing is that, well, I say by however you present your product, why is specifically a general federal court added the requirements that it can't be arbitrary. So what does that mean? That basically present it, but you can't just say, yeah, I don't present it, so I'm making a general purpose device, so a general kitchen knife, but I'm selling it only in hospital. I mean, come on, guys. That's a medical device. That just doesn't give. But practically, if you only sell it to doctors, it will be a medical device by the way you're doing your market. So it's not arbitrary where you just can say, well, I'm benefiting from one end, but I'm avoiding the constraints on another one. Now, as I said, this was about software. I'll go very swiftly on this because we're talking mostly about what can be done in a lab, but software is also done in a lab. So let's go very quickly on this. A software, everybody knows, I assume what it is, but it's a set of instructions that process data and creates output, input, output, and the software is what lies in between. Standalone means that it's not in another device. For example, you have some embedded software in not a glue. Without the pump, it's meaningless. No action on data. So that will become important in the next step. No action on data is that it just moves around the data. It does not change it. For example, and if you just move around the data, you actually don't change anything, and so you have no responsibility that is created by moving around the data. So you can read it here: storage, communication, simple search, or lossless compression. You actually don't take decisions, and therefore there's no responsibility that is created on your end, because if you have no decision, well, you can't do nothing wrong if you don't do anything. Lossless compression. Why? Because if there is loss, you have compression that where you lose data. Well, there you made a decision that the data you lost was not important. Accessory. An accessory is something that is sold with the device, but and intended to be used with the device, but that is not itself a medical device. I can give example a bit lower. The gel for an echography machine is an example of an accessory. The stand for perfusion pouch is also an accessory to medical device. The bag for portable device, for example, an ecography probe, is also an accessory to a medical device. Those few definitions. What do we need to do to know if it's a medical device? A standalone software medical device, and that's why I'm making this. This is also applicable to general medical device, not only software, but there's a couple of stuff that are specific for general. Well, if it's a software and standalone, then that would be a medical device. If it's not a software, this would work. If you have an action on data, then you take some responsibility. If you don't do any manipulation on data, for example, you just have a form where you capture data, not a medical device. If you just display data, like in a table, well, no medical device. If you make a graph of data, this is a tricky question, and if you're interested, we can go into it. Depending on how you will present it, we might argue that you are acting on the data. And interesting, individual patients. Why is it there? Because if it doesn't benefit patients, but the general population, that would become into public health. You wouldn't take the responsibility of a single doctor away, but more of the system. For example, statistics over different, like all the patients in neighborhoods, well, that wouldn't be a medical device, a software doing that. Does it have a medical purpose? Well, all that medical purpose, of course, it's not a medical device. And is it an accessory? Well, if it's an accessory, but it's an accessory. If it's not an accessory, then it's a medical device. An example, that is an interesting one. Sorry for the abundance of text. Prefer to make just images, but here it was about the medical world and regulatory world is quite verbose. Apologies for that. Software that allows users to store and communicate pictures of moles to a doctor. Basically, you have the camera picture of your face, send it to the doctor, and you can communicate over it. Is that a medical device? Well, no. The app doesn't perform any action on the storage or communication, so another somehow form of storage. Now, the second app, pictures of moles on the skin for storage and comparison, and uses an image processing algorithm to provide assessment of the scanned moles. Well, that is the app uses computer, image processing. It is for a medical purpose, so it has all reason to be a medical device.
Already want to get this shit off the screen.
So, okay, there's a couple of things here. I use a bit the words of lawyers, which is likely to be considered a medical device, because interestingly, when you work with some consultants, they will not tell you what is the clear truth, some sort of ground truth. Europe specifically, because in the US you can ask the question to the FDA and they won't necessarily answer, but at least there's someone which you can ask and might answer, which
every question is bullshit, man. Somebody ask a real
Please, guys, check your microphone. If you have it on, turn it off.
Voila. Yeah, in the FDA you can get an answer from the FDA in the US. Now, finally, about this first part, it's if you have a software, you can split it in modules. If you have a hardware, you can also split in modules. Interestingly, you can divide the pieces that are key and have in the software, it's easier to explain, that are acting as a medical device, that have an action on the data, and document those that are regulated, those pieces that are regulated following the guidance, and the rest doesn't have to be documented the same way. So in a nutshell, follow best practices and split your project in modules. I said this already. There's a lot that I haven't covered here. The difference between the EU and the USA philosophy. In the US, you have the 510K, which means basically that whatever already is on the market acts as a reference, and you can compare yourself to that, and you just need to be as good or better. In the EU, it's a more scientific process. You define your claims, and then you just need to prove that you are right with your claims. The EU and in the EU, I didn't go into the risk classification and the classification of the class of your medical device, the sterile, etc., the different brands of class 1s, class 2A, 2B, or 3, depending on the risk of your device. Basically, you have an implantable heart prosthesis. Well, that would be a class 3, very high risk. Have a very low risk device, well, it would be a class 1, and you don't necessarily need a notified body. I didn't go into the regulatory pathway, that's also an important stuff. I didn't go into the same equivalent for the US. Didn't go into the reimbursement pathway, which many people are very interested after that. And I didn't go into the technical documentation, which is basically how do you document all of this to certify your product once you know it's a medical device. But now comes the second question, which I will open the floor gradually. It's what can be done in the lab. And so very quickly, why do I give this presentation? Why am I interested to share with you all of this with the Fab Care community? Because my belief is, in general, Fab Labs are stuck, they're a bit stuck. Because we need to start making qualitative products, and many Fab Labs are not. Just because, well, infancy of the projects, and you do 3D printing. It's very impressive for what it can do geometrically, but not necessarily to make durable or reproducible products. The thing is, I think there's a slide missing somewhere, but anyway, well, quality management. That goes over quality management. Is basically defining what you want, designing for it, and verifying that you have what you wanted before you started designing. The thing is, the medical world requires quality, but also pays for it. The margin for medical devices is quite high compared to other industries. But also the impact of medical devices on health and society is quite high. The impact of Fab Labs in making medical device could thus be much higher than it is right now. So another time we can go over quality management and the basics, what we can do over this. Voila. Now I wanted to finish with two things, inspiring Fab Labs or medical projects. Things
get this shit off the screen.
Voila. We have Gani Prosthetics and Protea, which is the workshop they opened in Kenya. Very interesting. They're making prosthesis, 3D printed prosthesis, and I'll go over what is interesting in their project. And then you have the Open Flexure microscope, the research project that Saad that I saw was among us, trusted to build in Singapore. It was tested in Tanzania with
We lost Jason. Just a second, I will send him a message.
Do you hear me again?
Yes.
I lost. Yeah. Okay. I'm back in. I will share this last.
Jason, you are muted.
I'm no longer muted. Apologies. I was saying Stick Lab is no longer the name. Sad. They now called Bongo Tech. Apologies, I was cut it out. And I started by saying this. Everything I've been saying is applicable to the EU regulation, to the European Union. Why am I saying this? Because many Fab Labs are not in the EU. And this is an opportunity because many of the regulations in many countries for medical device development are not very mature. That means that you can go talk to them to help them design one regulation that is appropriate to the development of the medical device manufacturing industry in your country. Specifically, I talked when we were in the Fab 23 in Bhutan. I talked with some people in Bhutan to see how that can be done. When I was in Rwanda, I did the same. That's something that is very, very interesting to start this conversation with authorities. How can we how can we design the appropriate regulation so that people can, so that every one of us can design some stuff. That's like relax on some ways the regulation. On the other hand, we'll definitely need to talk, as I was saying, in Fab Labs about quality assurance and making sure that what we produce will not kill anyone. That is, and will, well, treat them, not put them but patients at risk. That is everything from me. The floor is yours, everyone. Voilà. Enrico, do you want to take the floor? Does anyone has any question? Wanted to keep
Well,
most of the time for discussion.
I can start with a simple question and a curiosity. So based on your experience and the examples you brought, what a Fab Lab should do? What would be the first step to move in this direction? So local checking, cooperations with doctors. What would be your suggestion?
Well, I would say it depends highly where you are. If you live in Australia, in the US, in Europe, regulations are pretty developed, and so it will be harder to just go under the radar. If you live in countries where those that are less developed, well, you can start making like alternatives. Fab Labs are real alternatives to non-existing manufacturing industry there, and specifically medical industry, which is a high quality, high quality industry. So the example of we talked in the general Fab Lab community, we talked about the business model of Fab Labs and the sustainability, the economic sustainability of Fab Labs, and that will be definitely another question if you try to make a product that is medical, where you will need to invest more time in just verifying that your thing actually does what you pretend or hopes it does. So in the testing. That's why I just mentioned Ugani and Protea. So those guys are friends of mine, and they're truly, genuinely interested to build prosthesis, so transtibial and transfemoral. What does that mean? That means people that have been amputed within their, like in their thighs. So the femur has been cut, or the tibia. And what they're doing is doing like 3D printing and assembly of prosthesis, high quality prosthesis in Kenya. And as far as I know, they didn't have any main regulatory question there. Talking about opening possibly a workshop in Asia, even though they're really interested to continue working in Africa. So I would say start with, if you are in countries that are not regulated, start with that. If you are in countries that are regulated, well, it's more complicated, because from the moment you start manufacturing, you will be responsible. So yeah, then you can go into the non-medical device world, and now you know the rules. Basically, if a doctor takes the responsibility of what you produce, it's not you doing it. So if you focus on the design, I have friends who will share another company, which is very interesting from a strategy, regulatory strategy perspective, Spentis. Also friends, also active in orthopedics and 3D printing. And what these guys are doing is that they have a software to design, to scan and design medical device, but they do not do the design. So it's a toolbox for orthopedists, so prosthetists, orthotists, and prosthetists to design the products and then to print them. In which case, the manufacturer of the actual product is the healthcare professional. And so they do not have to be regulated as medical devices. They're just designing stuff. Voila. Long answer to your question, but trying to be thorough.
No, that's perfect. Thank you. And any suggestion on, let's say, before you said that there are some accessories. Can you hear me?
Yes, yes. I'm trying to read Rico's question. Is an assisting device implying less legal liability than a medical device, or are they the same? I don't understand the question. I don't understand. Rico, can you maybe unmute and explain what you mean? Ah, you mean maybe prosthesis, assistive. Okay, assistive device. Okay, assistive device. It's a tricky one. It's a tricky one. I will share again my screen. So if we go here, diagnosis, monitoring, treatment, alleviation, or compensation for an injury or disability. So technically, assistive device would be compensating for disability, and therefore, under European law, they would be a medical device. So they're not more or less, they're just as well. Enrico, you wanted to ask something else, I guess.
Yeah, I was curious to understand, before in your presentation you said that not everything is a medical device. Sometimes you have accessories. I think you defined them.
Yes.
The example was the gel for the ecography.
Yes, yes.
Do you think that that's a sector where there are more needs that are easier to fix compared to proper medical devices?
Well, an accessory to a medical device, let's go back to the definition here. An article which, whilst not being a device itself, is intended specifically by its manufacturer to be used together with the device to enable it to be used in accordance with the use, blah, 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 blah. Basically, an accessory, you can't, I mean, it's difficult to sell it. Well, and so I'm saying selling because, I mean, if we're building it, we need to find it a usage. So selling it is quite important. The who is using it afterwards. So not really, no, because it's associated with a medical device. So yeah, it's a bit the question. Like, you have a laptop. Is there a business is making like cases for laptops? Yes, definitely. But is it really a business if you're not making the laptop? Not sure. It could in some ways, but the question if you're making it as external to the medical device, somehow it should have some sort of autonomy, which might make it a medical device. So it's a tricky one. Again, if you have a specific case, we can definitely look into it. But generally speaking, no. Accessories, no. What is, for me, very interesting is to start together developing. I think it's a significant step to go into manufacturing medical device in Fab Labs, which is why we should do it. Because it will significantly improve whatever we make in a Fab Lab. Now, we will need to somehow invest time to develop such procedures or devices to test. We have a lot of machines to design, to manufacture stuff in a Fab Lab, to produce. Now, the question is, how can we, shouldn't we like have more devices to test the quality of what we make? For example, I haven't heard of a what's the name? A mechanical resistance test, or for example, that's where I think the people from OpenFlecture were really impressive. They made a fatigue test. They designed something to make fatigue test for their microscope with lots of flexures. That is very interesting. And once we have these, then we can, at low cost, test what we're making. But basically, there's no real shortcut to get into the medical world because we don't want to hijack the patient's health and put it at risk. So, yeah, that would be my answer.
Great. Any other questions? Maybe we can.
Yeah, so maybe one last idea is, again, going back to Ugani as an example. If you know people that are, if there are companies that are making medical device and wants to go into distributed manufacturing that already have some procedure in place and you just need to apply them, that can maybe bump up the quality level, the quality control in your lab, and then you'll be able to transition, once you already have the habits, the procedures, etc., transition to manufacture other stuff. And that's why I was giving the example of Protea. They're looking into what other country they could set up a workshop. Yeah, I see QA from Antonio. Very good, a very good suggestion in the Internet of Production. Yeah, that's. If you find someone that already has quality control, start by making something else. You focus on the manufacturing and execution, and then you go up into the design. Voilà.
Sounds great. Any other question? Otherwise, I'd like to use the last 10 minutes we have before the end of the day to check if people has any other specific interest or topics they want to explore, or medical devices that they did in the past. Rico, do you want to speak?
Rico? You're muted. Ah. Until Rico speaks, I can give ideas of stuff I would like other people to take over. An easy medical device that is not really a medical device, if you ask some people, would be a digitizer for microscopes. So I was in Africa for around 6 months to digitize microscopy because, well, a regular microscope is nice, but you can't collaborate on a microscope. It's very difficult. People are always like that. It's tiring for the eyes, so lab technicians are not super happy. And so it's basically a camera that you connect to a computer that you put on a microscope, and you put a screen. And then 2 lab technicians can look at it. You can record the image, give it to the doctor. It's not completely a medical device, so you would go under the regulation, certainly if you're doing it in a developing country. And so I would say start by doing that. That's an easy one, very easy one. And then you just need a little bit of software to run with it. And then you can even start making you collaborate with other people to give them access to the images and do lots of deep learning and AI and data processing and whatever, and create even more value for the local lab technicians. Another one that I would love to do if people are interested, but it's way more complicated, it's stuff that Beneficial Bio is doing, is starting to manufacture PCR device, PCR kits, diagnostics locally in containers. But it's definitely not easy in terms of regulation. Tried unmoving, no luck. My third question as follows. Okay, Ronald, given medical needs are quite universal, is there a repository of needs where Fab Labs can collaborate to look into developing solutions? Yes, there is. I don't remember the name of the website, but there certainly is one somewhere. I apologize, I have no clue what it was, what it's now. I forgot it, but somewhere there is one, and I'm a member of it, and every 6 months I receive an email, a notification about it. There is, the problem is these things, as every community-led stuff, they're not always enough, traction, momentum on some specific stuff. Gosh, and under section of GOSH, such as Africa OSH, also exist and work, but they're more GOSH in Africa OSH and other OSH. So OSH standing for Open Science Hardware. They're specific on science, and so nothing there is necessarily regulated yet. I don't know of an initiative. Maybe Antonio, is there an initiative at Gosh to build medical devices, or it's still at the science level?
Definitely for PCR, I have seen a few efforts, and in Joggle, during the COVID response, there were teams like developing open source PCR devices. There are all the information is there in the forums. Yeah.
Yes, yeah. So again, Sad, very much agree. My question with the Pocket PCR of Gaudi Labs, definitely. I will answer Rico's question. It's a very good one. So yes, there is a lot of initiatives. My question is on all of this. I haven't seen the procedure to actually test it. You know, the things from Gaudi Labs, the PCR stuff, or Beneficial Bio is doing open source PCR enzymes as you manufacturing, and they are trying to make it available for everyone. But it's in more biolab than Fab Labs. To answer Rico's question, since responsibility equals legal liability, it may be too big of a hurdle for Fab Lab and makers to overcome. I wonder if medical device can be designed and offered by a Fab Lab. Yes, but then that does not fit my personal requirements, which is to make it sustainable. Because if you give things for free, then it's not sustainable for the lab. And so that is a way that would be similar to what Spentis is doing, for example, which is they help you design it, but then you finish it up, you validate it, and so you own the responsibility if there's a problem. So yes, definitely, it's definitely one way that you could circumvent the legislation. But again, what I told you about is for Europe. Japan has other rules. Canada has other rules, and I'm not sure if you could circumvent the legislation there with such a trick. Supposedly, I imagine that yes, but in practice, I don't really know. Wanted to say something about that, Rico. Yeah, you definitely need to make sure that the person in front of you accept the responsibility, and that you are not the one believing that they have well understood that it's at their own risk. I would say, well, yeah, you're responsible for it. I think the issue in non-developed countries. So having discussed with the Rwandan FDA, I can't say for all developing countries, because there's lots of ways you can move on this, but the regulation is only one part. It's the biggest part is the standards of quality, and there definitely there's education, but it's also practice and procedures, and when you do something you verify that you done what you wanted, and that's already done in the if you follow Fab Academy, basically measuring the parameters, characterizing your machine, so knowing what's the curve of your machine and countering it in the design is definitely the right mindset to approach this. In general, quality is more about mindset than regulation, and regulation can actually damage quality more than build it. So I would tend to point to mindset rather than regulation. And in developing countries, I would say it's the lack of regulation, but the lack of proficient industry. That is the challenge. So basically, you don't have the right role models, and you don't have the place where you can actually go learn this industry. For example, if you don't have testing, the appropriate testing machine in the country, well, how will you do it? I know Quentin is a friend of mine who studied with me, is now in MIT with Neil. They have a micro CT scan. So they can just take a 3D scan of the interior of whatever they want with X-ray. So they can check stuff that I will never be in my life, most likely, be able to check. Like we can take that at a very much lower level. For example, a microscope. If you have a high performance microscope, you can check very tiny stuff. If you don't have a microscope, you need to check with your regular eyes. You will never find tiny details. If you have to do like repeat fatigue tests 10,000 times the same movement, well, you won't do it, and at least in a reliable way. And so you won't be able to produce a test that is reliable at the end. If you see that machine, that can be great. So one thing that we could work on, not to actually make medical device, but to plan ahead, is develop machines for testing and equip labs with quality control machines. Are there any standards or guidelines on how to handle disposal or recycling of the device made in Fab Labs when they're no longer in use? What are you referring to? Hello, Nandita, and what are you referring to? What kind of devices? I don't understand the question, but Antonio seems to have understood it. I don't know if anyone, I see that it's 5:28, so we have only a couple of minutes. I hope what I shared was useful. If it wasn't, please tell me. If you wanted to know something else that I didn't cover, it wasn't clear, please tell me. And I'll definitely still be available, well, most of the time, or answer in a timely fashion as much as I can. And maybe I will use the last minute and a half to hype Alberto, if Alberto is still there. Yes, he is, I think. And push that we want to have a healthcare challenge in Puebla, don't we? Please, Alberto, open your mic. Nope, too bad. Yeah, well, we want to have a healthcare challenge in Puebla at the next Fab conference in Mexico that Alberto is organizing. So thanks for organizing that, and let's hope that we'll have one.
That's an amazing
the best
idea.
advice I can give. That's the best way to wrap this up is we're talking. I started with to talk about responsibility. So to take Rico's idea and to make it into Fab Labs, bring doctors in Fab Labs. Because if you want to avoid the regulation, you need them to take the responsibility. And if they want to bypass, well, the industry because it's too expensive, then you need to take the responsibility. At least if we follow the European model, there may very well be other ways to look at this than the European one. And if you do so, just bring doctors to hospitals, bring doctors to Fab Labs and nurses and physiotherapists and everyone. Bring them into the Fab Lab, show them that they have the power to design whatever they want. And to answer Ronald on bring Fab Labs to hospital, yes, I would love to say yes, but every time I've seen this, actually, it doesn't work yet, because what you need to create in the doctor's mind is this mindset that they can create stuff. And the hospital is about treating patients, and it's about executing existing processes. The hospital is about emergencies. It's about triage. It's about what is most important. And in the hospital, it will never be the most important to design a new device. It will be to save a patient. And so it's better to take the doctor out of his, emergency, I can be called at any moment, and save someone's life, so that they can start to open their eyes to a different future, an alternative to a traditional medical device manufacturing. And I think that's a wrap.
I see your point. Just one note on what Ronald said. There is an experiment in Hamburg about it. And one of the person involved in that is inside the FabCare WhatsApp chat. So Ronald, if you want to ask some specific details, you can do that through the FabCare chat.
and Antonio is mentioning humanitarian organization like Field Ready, work with doctors organization, and I think humanitarian organization and mobile Fab Labs for humanitarian for refugee camps is a very good example where the doctor, the Fab Lab and the doctor are pushed on the field. The doctor are moving also into the Fab Labs and see what can be done there. Because basically logistics is always a challenge if you need something specific and you're in an emergency. So that can be a good alternative. Thank you very much for your time. I hope I was useful. If you have any questions, I'm also in this Fab group, in the Fab Care community, and I'm also in the Fab Care group, and also in the Fab Care community. I created a second one, which if you're part of the community thing, you can also access. What is it? Currently, there's basically no messages, but it's really about building medical businesses in Fab Labs, because I think that's a great way to move this forward.
That was amazing. Thank you very much, Jason.
I will.
Big round of applause, virtual round of applause. But thank you very much. So
Good.
We have some
links. And I really wanted people look at Antonio Anaya stuff, because it's very good. What Internet of Production and are doing is really interesting around healthcare as well.
Maybe that will be the topic of the next meetup. Antonio,
thank you, Jason. Yeah, definitely. I would love to share a little bit.
Okay, cool. So if nobody else wants to add anything, thank you very much, everybody, for your time. Thanks, Jason, again. It was great. And hope to see you soon on the next meetup. Bye.
Thank you, everyone. Hello to all of my friends, and good evening if you're in Europe, and whatever else if you're.
See you. Bye.
Bye-bye.
Bye, everyone. Thank you.